Hi there, this is Kelly Dean from the Tummy Team, and July is Diastasis Recti Awareness Month, and we always do a big thing during DR month. In July, we usually try to look for ways that we can get as many resources out to all of you in the most effective way. And so this month we are doing kind of the most commonly Googled questions about diastasis recti. And each day we're going to kind of tackle one of those questions with a really great answer. And we've also created a page on our website that kind of looks at all the most commonly Googled questions and what the answers are. Every Tuesday in the month of July, we're going to do a live video and a chat with you guys, with me, so that I can answer some of your questions. And several people have emailed and posted questions for us to answer. We're kind of trying to find different, there's so much to talk about with diastasis. So we're trying to kind of look at like sections, and this week's section was diagnosis and treatment, to kind of get all of like those types of questions. However, I'm going to answer whatever question you guys sent me, right? Because that's what we do here. We answer your questions. And it's really, there's so much confusing information out there. So don't feel discouraged if you feel like, gosh, I read this and I read that and I read this. I'm trying to help you get like kind of clear, concise information. Our mission statement at the Tummy Team is to validate people's stories, to educate you on what's going on with your body, and to offer you really great resources. And some of those resources are free, and some of those are online programs, our splints, kind of our rehab process, that kind of thing. So I'm going to just get started with a couple of questions that came through. The first question was from Yolanda. And what she asked was, I experienced diastasis recti during my first pregnancy 14 years ago. I didn't know what it was for many years, but I knew something wasn't right. That's so true, right? A lot of times we're like, I don't know what the diagnosis, but I don't feel like myself. Something's not okay. And then her main question is it too late for the muscles to come back together? Absolutely not. I just worked with a 70-year-old who has closed their diastasis that they had for 50 years. And it was a 6-finger wide diastasis, and it is now 1 and shallow, which is what I feel like is a pretty healthy post-diastasis connective tissue. So this is the reason. The thing is, the muscles, it is a connective tissue problem. The diastasis right down the center, but it's also a muscle problem. The transverse abdominis, that muscle that comes around, that holds the two sides together so the connective tissue can heal, that muscle is a postural muscle that's designed for all-day use throughout the longevity of your life, right? So you can build muscle in your 90s and 100s. You can build muscle at any time. The real question is, how do you do that? And we really believe that since the muscles of the core were designed for upright support, that we train them upright. We train them in sitting and standing postures so that the movements that you do are functionally relevant into the real movements that you do. So the rehab meshes with lifestyle really quickly, and that's why people get better so much faster. So the answer is it's not too late. It's really never too late to rehab your core and to balance out those muscles and to heal a diastasis. Okay. Second question, Isabel. Hello. I've been working with a PT on strengthening my pelvic floor and some on diastasis recti. Good for you. I have 2 kids, both vaginal births, unmedicated, planning on a third soon. Do you think I can start rehabilitation in time to prevent additional damage to the fascia tissue and have a better chance at recovering post-birth? Thanks so much. Yes, we highly, highly, highly recommend that you can strengthen and should strengthen the muscles pre-birth, whether you're pregnant now or not. But if you have a diastasis, Isabel, and you're still recovering and you want to have another baby, I would really encourage you to do our Core Foundations 8-week program, because it step by step gives you the functional strength that you're going to need going into pregnancy. And then we have an additional pregnancy program that really works on the coordination between the core and the pelvic floor in preparation for birth and pushing, and also works on fetal alignment and all of the aches and pains and stuff that happen. So you can usually people see significant improvements in our programs in the first 2 to 4 weeks. They can see a huge improvement, and it's a little bit easier to strengthen the core and to thicken the connective tissue and revascularize the connective tissue of the diastasis when you're not pregnant because of hormonal components. But you can still do it while you're pregnant. The muscle building still happens while you're pregnant, and the connective tissue can still thicken and still get really good vascularization so it can start to heal. But more than anything, what you want to do is prepare and be connected to your core and pelvic floor muscles in a really practical way going into your pregnancy so that you have a better birth recovery. It sounds like you're having fairly uneventful births, fairly natural births, but that with each consecutive pregnancy, when you have that diastasis, it can make each birth a little bit more difficult. So getting that help now, absolutely, I would totally recommend that, obviously. We always put things off because we think it's going to be harder than it is. And I'm not saying it's not an investment of your time and energy, but it's not as hard as what people think. And I am the worst PT client ever. Like, if I go to a physical therapist, I'm not really good at laying on the floor and doing exercises. I really need it for myself, for it to be meaningful and to build into my functional day. And that's how I teach people in our program, because I want you guys to have those strategies to be successful. Because, we all start out with the best intentions, but I want to give you the tools to carry through and be successful. Okay. All right. This next one is from a man, anonymous man. And he says, can a male with a large diastasis separation and a large hiatal hernia try to rehab with a splint and exercises, or does the hernia need to be fixed first? Okay, so we do a lot of work with diastasis and hernias, and a lot of the hernias we see we're right down the midline, either a ventral hernia or an umbilical hernia. Those are really connected to the diastasis. But what's happening a lot of times, especially with men with diastasis, is it's developed from a muscle imbalance between the internal and external abdominal muscles. And the strategy they're using to stabilize, to strain, to lift, to challenge their body is bracing, breath holding, bulging out their tummy. Kind of this push, 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 grunt. And that pushing out, that pressure that goes here, also can kind of go here and here. So can press down for pelvic floor problems and can press up. And that's where that hiatal hernia is basically your your esophagus or your tummy kind of pressing up into your diaphragm. And it makes a lot of heartburn, and it's really difficult with digestion. And so even though it's not really a part of the diastasis rehab process, it's a separate condition, they're connected because of that inner abdominal pressure that's probably the cause of both things. So you are probably going to need to have surgery to repair the hiatal hernia at some point. But we always, if it's not an emergency surgery, we always recommend doing diastasis recti rehab prior. Any functional core rehab prior to an abdominal surgery is going to be in your best interest. The reason is you need to retrain the muscle memory so your core comes in and draws the muscles in without pressing out and the air pressure going up, with lifting and postural and sitting postures and all of those things that you do all day long. You need to try to do that sooner, right? Because after the surgery, you have a muscle memory problem. You now have trauma to the abdominal muscle. There's been numbness, there's been incision and stitches, and now you have pain, so you're protecting it, and you're moving in a lot of difficult postures. So if we can correct that beforehand, then you're going to have a much better success in your hernia repair. So short answer, I would do the splinting and the rehab, and you would probably see a minimization of your hiatal hernia symptoms, and then the surgery is going to be more effective because your post-surgical recovery is going to be much better. Because this is the other thing, if your strategy is to push out all the time, and now you have incision and you're trying to protect that incision, and you go back to like heaving yourself out of a chair or something like that, it can totally press up. Okay, I'm going to answer one of the questions on here about can it help with botched C-sections. Okay, so I'm not sure exactly what you mean by a botched C-section, but if you have kind of like a scar tissue or you've had a lot of trauma in the incision of your C-section, that is what we call abdominal trauma, and it affects how you connect and activate your core muscles, and it can totally impact the function of your core and can lead to or contribute to a diastasis or a diastasis not healing. So what we look at is, even though this is Diastasis Recti month, I want you to recognize that it's functional core rehab that we are looking at, okay? And functional core rehab is rehabbing the core muscles and the pelvic floor muscles and all the muscles that wrap around your torso to hold you up and hold you together for the daily life, things that you need to do all day. And so if you have any trauma to your core, you're not going to be using those muscles properly. So then you start to use all the muscles around your pelvis and all the muscles around your rib cage in really tight ways. And that leads to other pain and other issues. So it's a big picture here. Diastasis is just a piece of a bigger puzzle. So functional core rehab, surprisingly, can help a multitude of issues. Okay, I'm going to answer another question here, and then I'll go to your question, Erin. It's kind of juggling lots of questions here. Okay, which I love. All right, this is a great question. This is there's 3 kind of connected questions from Shannon. Is there any correlation between diastasis recti and endometriosis? So I don't know if there's really actually a connection there, but I can tell you this, that sometimes people that have a functionally weak core and a separated abdominal wall, usually it's together, their abdominals are not supporting their internal organs effectively. Okay, and so if the internal organs, when you have a nice connected strong abdominal wall and you're using your muscles pretty effectively throughout the day, it brings blood flow in to that area, and blood flow brings in nutrients and flushes out toxins. So this can really help with people that are having a lot of kind of menstrual cycle issues, cramping, cramping or lots of heavy cycles or just different things going on in their menstrual cycle. A lot of times we can see a huge change once they start getting connected to their core. So as much as I don't think that there's a direct correlation between endometriosis, there is somewhat of a connection between a functionally weak core and a diastasis and kind of menstrual cycle issues, if that helps. The next question is, can DR cause gut issues? I'm not sure if it causes gut issues, but it's connected. So there's a correlation there. So what I mean by that is what we see commonly is either irritable bowel syndrome, where it's kind of like cramping and then diarrhea and then cramping and diarrhea, and kind of like just like an ineffective peristalsis of the intestinal tract. Also constipation, where things get really backed up. Again, lazy or ineffective peristalsis of the intestinal tract. Again, this comes down to if the core wraps around and holds the intestinal tract in a nice supportive position, it brings in blood flow to that area, and it helps a lot with the function. The intestinal tract is kind of like plumbing, and it does well with extra kind of support on those structures. So it's definitely related, and we see huge improvements in constipation, and constipation is a huge connection to pelvic floor dysfunction and prolapse. So it's all, your body is a really dynamic system, and the core, the muscles that support the core are supporting all kinds of organs and structures in there, your intestinal tract, your reproductive organs, but your stomach, your liver, your kidneys, everything's kind of supported in there. And when that support system's doing its job, it not only helps with your posture and supporting your spine and decreasing back pain, but it helps with the function of a lot of other things that you might not have ever thought were connected. Okay? All right, the last question from Shannon was, is pelvic pain associated with DR? Yes, absolutely, because the transverse abdominis, that internal corset muscle, wraps around, attaches to the upper, at the upper part to the lower 6 ribs and around the pelvis all the way to the pubic bone. And it kind of goes all the way around and kind of stabilizes your pelvis. So without that good stabilization, instability can cause compensation in muscles and can cause joint laxity that causes a lot of pelvic pain. So it can cause pubic symphysis pain, SI joint pain, tailbone pain, sacrum pain, all kinds of pain. If you're talking more about pelvic pain related to pelvic floor muscles, it can be connected there too, because the core and the pelvic floor co-contract and work as partners most of the time. And if the core is weak, then all of the weight of the organs can rest down into the pelvic floor. And then the pelvic floor is now in a challenged position where the muscles are straining and aching and cramping, and that can cause a lot of pelvic pain. And it also can allow your intestinal tract, your bladder, and your uterus to kind of drop down. It also can put a lot, and man, it can put a lot of pressure on the prostate. So that can all be part of the big picture. Okay? All right, I'm going to go to Erin, your question. Not sure if this is where to ask. I'm curious if healing a pregnancy / labor induced. So hold on a second. Let me see if there's more of a question there. Okay, diastasis is once and done thing, or if it's a permanent way of life. I have a 3-finger diastasis, very thin connective tissue. Desperate to move on to simple labor. Okay, all right. So I think the big question is once you heal a diastasis, or is it always going to be healed? So it depends. It really depends on the way you heal it, in my opinion, because there's a lot of programs out there, a lot of people that I've worked with that have done other programs that are very exercise based, and they can get their diastasis really closed and feeling fairly good until they stop doing the exercises or stop splinting, and then it comes right back. Okay, so that's not effective, right? That's kind of, I don't want to say it's a waste of your time, but your time is really valuable. And if you're going to invest that much into it, then you should have lasting results. So the way that I approach diastasis recti healing is part of it is abdominal splinting, and part of it is using retraining and doing some exercises for the transverse abdominis. But as quickly as possible, from the first week, we start building those muscles into your functional movement patterns. Okay, so how you sit in the beginning, to how you stand, to how you lift your kids, to how you go to the bathroom, trying to really help you get the functional integration of these muscles, because they are not crunch muscles, they are not plank muscles, they are postural, structural, digestive, respiratory muscles at their base function. Okay, yes, you use them when you exercise. Yes, you use them when you strain and when you lift. but they need to be used all day long to get enough strength and muscle memory so that they start working kind of naturally throughout how you move. And then you come back to start doing some resistance work, and you work on exhaling and engaging the core on the resistance and work on that coordination. And then we work on putting you in different alignments and different postures and coordinate upper body and lower body so that you can get back to whatever the things it is. Sometimes people want to get back to yoga or walking or running, or some people want to be able to horseback ride or, swim, or do a triathlon, something like that. It really depends on what your personal goals are, but you have to start with the foundational blocks and then build up. Okay. So if you get pregnant again, it is like you had a previous injury, and it is possible with the hormones that you develop another small diastasis. But if you work the muscles into your pregnancy, throughout your pregnancy, and that connection to your posture and alignment and how you're engaging with your core with all the things you do throughout your daily life, then that, even though the hormones and that previous stretch makes you susceptible to another diastasis, it's likely not going to be as severe, and it's going to heal very quickly postpartum. And then you have to kind of do a little bit of the work. It's kind of like if you sprained your ankle really bad when you were younger, like you can probably get back up to running, but if you're going to twist an ankle, it's always that same ankle. It's just a little bit weaker than the original. And that's what I say. It's a little bit weaker. It's a little bit more vulnerable than if you had never had that injury. So you always have to be a little bit aware of that. And it depends on how thick you can get that connective tissue, and how strong you can keep your muscles while you're doing different things, what you're eventually going to be able to do. But when you have that really thin connective tissue, that is telling me that we really need to work on the consistency throughout the day. I'm not familiar at all with the program that you are talking about, so I can't really speak on that. I can only and I try not to speak about other people's programs anyway. I'm not an expert on other people's programs. I can only tell you what we do and how we do it and why we do it, right? Okay. Jenny sent me a message or a question and said, can diastasis recti be worse, wider at certain times of the month? Yes. Okay. It definitely can, especially when you are in that kind of healing phase of it. So there are 2 significant spikes in our hormones through our menstrual cycle for women, okay? We'll talk a little bit about this for men too, because they don't have the same cycle, obviously, but there's other hormones that are involved too. So with women, we have, when we ovulate, we have a spike. You remember back in health class where, kind of our hormones spike up and then they come down and then they spike up again right before our period. So they spike up to release the egg from the ovary, okay, during ovulation. And then when they come down and they spike up again, right about 2 days before your cycle starts. Okay. Those are the 2 times that you have increased elasticity in your body and in your connective tissue. These are the times that most female athletes injure themselves, which is kind of crazy because usually during ovulation, most of us feel pretty amazing and, feel pretty strong and want to do a lot of stuff, but there's increased laxity in our connective tissue, which can make us prone to having like an ACL injury or some other kind of shoulder dislocation, something that's more connective tissue related. It's really common. Okay. So that being said, if you are checking your diastasis around those 2 times, it may feel softer and a little bit wider, because the laxity is not holding the integrity of the 2 sides together as much. This is similar to if you, when you're pregnant, right? Especially the first 3 months of pregnancy, if you have a past DR and you get pregnant, you'll be like, oh my gosh, it's like, boom, came right away. It's because that very early pregnancy, we have such a flood of hormones trying to build the placenta that we're really, really, it's really most dramatic at that very beginning part, and then close to the very end. The middle part doesn't seem to be as high. But there's other hormones too, that cortisol being one of them, a stress hormone that can break down connective tissue. And I see this in women and in men that power through pain and have a lot of high intensity stress in their life. And that can really affect our connective tissue as well. And we actually have a whole video blog on hormones and diastasis recti, and it's on our YouTube page, but I'll have Sierra, my social media girl, post it at the end of this, so you guys can, in the comments, so you guys can watch that video if you want. It tells you a lot more. Okay. The other question that Jenny said is, I'd love to learn more about doming. So what I'm thinking you're saying here is that, like, that pressing up that you sometimes see, we call it the alien, we call it the football, we call it the dome, the tenting, where your tummy kind of, when you go to sit up or do a sit up or a plank, or you get out of bed or you cough and you see your diastasis kind of go like that. We want to discourage and minimize that at all times, as much as possible. As soon as you notice that happens, that is a signal to your body that my body is using inner abdominal pressure, holding my breath, tensing up, bulging, some kind of strategy that is going to push out on that connective tissue. And at any time, but especially when you're trying to heal that connective tissue, I need to plug in my computer. Sorry. Anytime you are putting extra pressure out when you're trying to heal it, it's almost like you're breaking these, like, as you start to heal, there's almost like these little micro, like, tissue that kind of goes in it, and it's like breaks that apart every time you push out on your abdominal wall. So our initial training for people is to watch for that, and that's a sign that something's not doing great. A lot of times clients will come in and say, see this, I can do this, I can do this. Watch, when I do this, it does this. And I'm just like, stop doing that, because it's just redamaging. So if you find yourself desperate to do exercises that you might not be strong enough for, and you see that tenting, you need to know that you are taking 2 steps back for every 1 step forward. And you need to just weigh the pros and cons of how important that exercise is for you. I feel like a lot of times as we get people stronger, we can get them back to doing the exact same exercise without the doming, with a nice, strong, connected core. You know, it's just kind of like if I were to, like, constantly hyperextend my thumb, hyperextend my thumb, hyperextend my thumb, hyperextend my thumb. And then I need my thumb to do this, and it can't do it. It constantly falls like that. It's just terrible for that connective tissue. So we want to not continue to put pressure on it. All right, last question, unless somebody posts something. Last question I have is from Elise. Does the belly button eventually look more normal? Okay, belly buttons are weird. There's lots of different things that could go on with your belly button. I'm going to speak mostly to pregnant women in this part, because that's where we really see that the belly button kind of starts to get a little bit, weird. So there's a couple things that could be happening. So the first thing I have a video about this too, about hernias and about the umbilical hernia and all of that. So there's another video about, is your diastasis really a hernia? And I have a little part that I talk about the belly button. So when we're born, everybody has a little bit of a diastasis, a little bit of a separation in their abdominal wall where your umbilical cord came out to connect to the placenta in your mother. Okay, when you're born, they cut that umbilical cord, tie it in a knot, and it starts to retract back into your body. And as it retracts into your body, the separation closes and it scars down internally, and it becomes an innie for most people. Okay, it kind of scars down and becomes an innie. What happens with a diastasis or with a lot of stretching of the connective tissue that might happen in pregnancy is we kind of have this pulling apart. And if it stretches enough and there's a lot of forward forceful pressure, sometimes that tether that is holding your belly button in either partially or fully detaches. If it partially detaches, you'll look like you kind of have a half innie, half outie. If it fully detaches, you now have an outie. We can totally close the diastasis with rehab and pull everything together, strengthen the connective tissue, but it's really impossible for the scar tissue to grow back once it's been severed. And so the belly button may always look different if that tether has been kind of pulled or partially pulled off, and it kind of half pulls out, sometimes at the top, sometimes in the bottom. So that's kind of what's happening. Some people, if they really are self-conscious about their belly button sticking out, there is a cosmetic surgical procedure where they can kind of just reattach your belly button and kind of sew it back in. But it doesn't have to like sew the diastasis closed. It just kind of pulls the belly button back in. But you know, once it's detached, it's detached. Now, a lot of times as people start working their transverse and their core, their belly button that was pushing out pulls back in because it wasn't actually detached. It was just the connective tissue was so weak and they were so used to pushing out. Okay. And then the last question from Elise says, can somebody with a DR who follows your program with discipline expect to be able to do physical exercises that put pressure on the belly? For example, a plank or other yoga poses. I haven't felt that I could do these for years due to a DR. Okay, yes. Okay, so I just don't think planks are the best choice for core fitness as a rule, but I recognize that they do have some benefits. What I look for is I want people to be able to hold their transverse together without any tenting or bulging, and be able to kind of zip up their tummy and kind of hold everything in without that bulging. So a lot of times you have to close your diastasis to a certain degree and build up that core strength. And then we start doing a progression. We kind of do like a wall plank to see if you can draw that in. You can also do like, then you can kind of go to like a countertop plank, and then you can go to, like a chair or a stool, and then you can go down. But some yoga poses take you through, like sun salutation takes you through that, and you want to be able to zip up. I just really have people watch, are they holding their pelvis and rib cage in alignment, or are they tucking and bracing their tummy? And that can be really difficult in a plank. If you're weak, you can kind of curve your back and kind of, gymnasts kind of call it hollow, where they kind of suck in, but it's the wrong kind of pressure on your transverse. And that's what I really have people do. But I've been able to get people back to doing most things. And honestly, I've even have gotten some people back to doing sit-ups, and I've done sit-ups with police officers and with people going into the military, and with people that have to do it for some specific fitness goal. Like even my daughter, she got her junior black belt and had to do 100 sit-ups to get that black belt. So we worked a lot on getting the coordination of the core. I don't believe like sit-ups are best for anybody, but there are some places where people need to do them. And so we really work on getting that connection to be able to do that. So those are the questions I have. And I was wondering if anybody else that's online right now has any other questions that we didn't answer today. We are posting new questions and answers every day. We take the weekends off, but Monday through Friday, the whole month of July, we're kind of answering as many questions as we can. And we're going to have another Facebook Live next Tuesday, and that one's going to be on diastasis recti and fitness. I mean, obviously I'll answer whatever questions you give me, but if you have specific fitness related questions that make you think about diastasis recti and can I do this, or how would I do this, or what do I do first, you know, that will be a great time for you guys to submit your questions to me. All right. I hope you guys are getting a lot of good information and feeling like you have a resource. I would love for you to check out what we do at thetummyteam.com. If you've never done one of our online programs, they are incredibly effective. They are an investment of time, but you are going to get everything you put in to that investment. Okay, you will be able to do this, and we have a client forum where we really support each other and kind of help each other there. Okay, so we'd love to help you. If you have any questions, let us know. And thank you so much. All right, we'll see you guys next week. Bye-bye.